Okay, so like imagine trying to catch your breath, just going up the stairs. Like you're carrying just a heavy weight on your chest. And this is the reality for millions who are dealing with COPD, chronic obstructive pulmonary disease. And you've sent in a ton of sources on this, including the GOLD guidelines. So it seems like you're ready to deep dive and really understand what COPD is all about.
You're right. Those GOLD guidelines are really considered like the gold standard when it comes to understanding and managing COPD.
Right. We're going to dive deep into those together in this episode to help you make sense of it all. Unpack some of the essentials like how COPD is even diagnosed and what the latest treatment options are.
Yeah, and we'll go beyond just the technical stuff to really understand how COPD can impact your life day to day.
So first things first, can you give us like a clear definition of what COPD actually is?
So in the simplest terms, COPD is basically a long-term lung disease that makes it harder and harder to breathe over time. So the airways, the tubes that carry air in and out of your lungs, they become inflamed and narrowed, making it tough for air to flow freely.
And it's not just about feeling a little out of breath every now and then, right? This is serious.
Unfortunately, yeah, it is a serious progressive condition. And while it is treatable and manageable, the damage to the lungs, it's irreversible.
Okay, so let's talk about what causes that damage in the first place. The GOLD guidelines mention a few usual suspects, don't they?
They do. Smoking is, of course, like a leading cause of COPD. The harmful chemicals in cigarette smoke irritate and inflame the airways, damaging the delicate tissues over time.
It's not just cigarettes, though, is it? I've read that other forms of smoke can be just as harmful.
You're right. Secondhand smoke, pipe smoke, cigar smoke, they all contribute to COPD risk. And it's not just about smoking itself. Exposure to air pollution, both indoors and outdoors, that can play a role too.
Yeah, I remember reading that things like dust, fumes, and even wood smoke from fireplaces can irritate the lungs.
Absolutely. And those particles can trigger inflammation in the airways, especially if you're exposed to them, regularly. And then there's the genetic component. If you have a family history of COPD, you might be more susceptible to developing the disease.
So it's like a combination of factors, often environmental and genetic, that can lead to COPD.
Exactly. Now, let's say someone is experiencing symptoms like coughing, shortness of breath, and they have like a history of smoking. What would you recommend they do?
Well, it sounds like a trip to the doctor is definitely in order.
Yeah, I agree. If you're experiencing those kinds of symptoms, especially if they're persistent or interfering with your daily life, it's crucial to seek medical advice. A doctor's going to ask about your medical history, your symptoms, and then they'll perform like a physical exam.
But to officially diagnose COPD, there's a specific test, right?
Yeah.
The GOLD guidelines mention something called spirometry.
That's right. Spirometry is a simple breathing test. It measures how much air you can inhale and exhale and how quickly you can do it.
So it's like testing the strength and capacity of your lungs.
Exactly. During the test, you'll be asked to blow as hard as you can into a tube that's connected to a machine called a spirometer.
And from that, they can determine whether you have COPD.
Well, there's a specific ratio they look at called the FEV1-FVC ratio. Think of your lungs like a balloon. The FEV1 is how much air you can blow out of that balloon in one quick breath. And the FVC is the total amount of air you can blow out.
So if you can't empty that balloon quickly enough, that could be a sign of COPD.
Exactly. If that ratio is less than 0.70, it's a strong indicator that your airways are obstructed. Of course, the doctor will consider your symptoms and medical history as well, but spirometry is like a crucial part of confirming the diagnosis.
Got it. Now, I often hear terms like chronic bronchitis and emphysema when people talk about COPD. Are these just different names for the same thing?
That's a great question. While both are often associated with COPD, they are actually distinct conditions. Chronic bronchitis, as defined in the GOLD guidelines, it's essentially a persistent cough that brings up phlegm for at least 3 months out of the year, 2 years in a row.
2 years in a row is the defining factor for chronic bronchitis.
That's right. It's not just a temporary cough. It's a chronic condition where your airways are constantly inflamed and producing, excess mucus.
That sounds pretty unpleasant.
It can be. Now, emphysema, on the other hand, involves damage to the tiny air sacs in your lungs. They're called alveoli.
These are responsible for transferring oxygen to our bloodstream, right?
Exactly. And when they're damaged, it becomes much harder to breathe because your body isn't getting enough oxygen.
So while chronic bronchitis is about inflamed airways and excess mucus, emphysema is about damaged air sacs and impaired oxygen transfer.
Precisely. And the tricky part is people with COPD can experience one or both of these conditions, and the severity can vary widely.
That makes sense. So how do doctors determine the severity of COPD? The GOLD guidelines mention a classification system, don't they?
They do. The GOLD classification system grades the severity of COPD based on that FEV1 percentage we talked about earlier.
So the lower the FEV1, the more severe the COPD.
Exactly. There are 4 GOLD grades. GOLD 1 is mild, GOLD 2 is moderate, GOLD 3 is severe, and GOLD 4 is very severe.
So it's almost like leveling up in a video game. But in this case, you don't want to reach the higher levels.
That's a great way to think about it. But here's the thing. COPD assessment isn't just about those numbers, those GOLD grades. Symptoms matter too.
You mean how COPD is actually affecting someone's life, their ability to, do everyday activities?
Exactly. The GOLD guidelines highlight the importance of assessing the impact of COPD on a person's life. 2 scoring systems come into play here, the mMRC and the CTAT.
Okay, those are new acronyms for me. Can you break those down a bit? What do those scoring systems measure?
So the mMRC, or Modified Medical Research Council Dyspnea Scale, focuses specifically on breathlessness. It asks you about how breathless you get during everyday activities, like walking up a slight hill, hurrying on level ground.
So it's about gauging how much COPD is limiting someone's ability to move around, and do the things they want to do.
Exactly. And the COKey, or COPD assessment test, takes a broader look at your overall experience with COPD.
What kind of things does the COP ask about?
It covers a wider range of symptoms, including cough, phlegm production, chest tightness, sleep quality, energy levels.
So it's a more holistic view of how COPD is affecting your daily life.
Precisely. And these tools, along with the GOLD grades, help paint a much more complete picture of your individual experience with COPD.
Okay, that makes sense. But there's another crucial piece of the COPD puzzle that we need to talk about. Exacerbations. What exactly are exacerbations, and why are they so important to understand?
Exacerbations are essentially acute episodes where your COPD symptoms suddenly worsen, requiring additional treatment. It's like a flare-up that can really throw you off track.
So things were manageable, and then suddenly, bam, you're struggling to breathe.
Exactly. And these exacerbations can range in severity. Some might just require adjusting your usual medications, but others can be serious enough to land you in the hospital.
Wow, that's a pretty wide range. What causes these sudden flare-ups?
There are a few common triggers, and believe it or not, the most common culprit is respiratory infections. Things like the common cold or the flu.
So something as simple as a cold can trigger a serious exacerbation in someone with COPD.
Unfortunately, yes. Other triggers can include exposure to air pollution, allergens like pollen or dust mites, and even extreme weather conditions like very cold or very hot temperatures.
So it's about being aware of your environment and taking steps to avoid those triggers.
Exactly. But sometimes exacerbations can occur even when you're being careful. That's why it's crucial to recognize those early warning signs.
Okay, so what are some signs that a COPD exacerbation might be brewing?
Well, it can vary from person to person, but common warning signs include an increase in coughing, a change in the color or thickness of your mucus, increased shortness of breath, wheezing, and feeling more fatigued than usual.
So it's about paying attention to your body and noticing any subtle changes in your symptoms.
Exactly. Early intervention is key. If you notice those early warning signs, contact your doctor right away. Addressing those early warning signs can help prevent a full-blown exacerbation and reduce the need for more aggressive treatment.
This all makes a lot of sense, but it's also a lot to take in. So far, we've talked about what COPD is, how it's diagnosed, those different scoring systems, and the importance of recognizing exacerbations. It seems like there's a lot to consider when it comes to managing this condition.
There is, and that's where the GOLD guidelines really shine. They don't just explain what COPD is, they offer a roadmap for how to manage it effectively.
And we're going to dive into that roadmap in our next segment. We'll explore those personalized treatment approaches in more detail, including the different medications and therapies available.
We'll demystify those treatment options and explain how they're tailored to your individual needs and goals.
So if you're ready to learn more about how to take control of your COPD and breathe easier, join us for part 2 of our deep dive into the GOLD guidelines.
Yeah, see you there.
See you there. Okay, so we've laid the groundwork, but now let's get into the nitty-gritty of managing COPD. You included a ton of stuff about medications, so clearly you're interested in those treatment options.
Absolutely. Medications play a crucial role in managing COPD and helping people breathe easier.
So the GOLD guidelines mention bronchodilators as a cornerstone of treatment. Can you remind us what those are and how they work?
Bronchodilators are medications that relax the muscles around the airways, which helps open them up and improve airflow.
So it's like taking the pressure off those constricted airways, allowing air to move in and out more freely.
Exactly. There are different types of bronchodilators, and the Goldie guidelines break them down into two main categories: short-acting and long-acting.
Okay, so short-acting versus long-acting, what's the difference?
Short-acting bronchodilators, often called rescue inhalers, provide quick relief from sudden shortness of breath. They work within minutes, but their effects typically last only a few hours.
So it's like having a quick fix for those moments when you're really struggling to breathe.
Exactly. Long-acting bronchodilators, on the other hand, provide longer-lasting relief, often for 12 hours or more.
Got it. Now, the Goldie guidelines give some very specific examples like SABA and LABA. I'm guessing those are acronyms for the different types of bronchodilators.
They are. SABA stands for short-acting beta agonist, and LABA stands for long-acting beta agonist.
So those are the two main types of bronchodilators.
Yeah.
Are they ever prescribed together?
They can be. Sometimes doctors will prescribe both a SABA and a LABA to provide both quick relief and long-term control of symptoms.
So you're saying that even though both medications help you breathe easier, they work in slightly different ways. And that's why sometimes they're prescribed together for a more powerful effect.
That's a great observation. Combining medications can enhance their effectiveness and provide more comprehensive symptom control.
Okay, so we've talked about SABAs and LABAs. What about LAMAs? I saw those mentioned in the Goldie guidelines as well.
LAMAs, or long-acting muscarinic antagonists, are another type of long-acting bronchodilator. They work differently than LABAs, but they also provide long-lasting relief from COPD symptoms.
So basically another tool in the toolbox for managing those symptoms.
Exactly.
The Goldie guidelines also mention inhaled corticosteroids, or ICS. What are those used for?
ICS are anti-inflammatory medications that help reduce swelling and irritation in the airways.
So they're not directly opening up the airways like bronchodilators, but they're tackling the underlying inflammation that's causing the problem.
Exactly. And while they can be used on their own, they're often combined with long-acting bronchodilators for a more comprehensive approach.
It seems like there's a real emphasis on personalized treatment in the Gold guidelines.
There is. COPD is not one-size-fits-all, and the guidelines emphasize that treatment should be tailored to the individual's needs and goals.
Okay, so we've got bronchodilators, both short-acting and long-acting, and inhaled corticosteroids. Are there any other types of medications that might be used for COPD?
Yes, in some cases, other medications might be added to the mix, depending on the individual's symptoms and needs. For example, some people might benefit from medications that help thin the mucus, making it easier to cough up.
That makes sense. It seems like the goal is to address both the underlying causes of COPD and the specific symptoms that are bothering you.
That's exactly right. Now, while medications are a cornerstone of COPD management, the Gold-D guidelines also emphasize the importance of non-pharmacological approaches.
Okay, non-pharmacological. What does that mean? We're talking about things other than medications.
Exactly. Things like pulmonary rehabilitation, for example.
I've heard of that, but honestly, I don't really know what it entails.
Pulmonary rehabilitation is a structured program that combines exercise, education, and support to help people with COPD manage their condition more effectively.
So it's not just about popping pills. It's about actively taking steps to improve your lung function and overall well-being.
Precisely. It usually involves breathing exercises, strength training, and endurance activities.
Wait, so you're saying that even though COP makes it harder to breathe, exercise is actually beneficial?
It might seem counterintuitive, but yes. Exercise is a crucial part of managing COPD. It helps strengthen your respiratory muscles, improve your cardiovascular health, and increase your overall endurance.
That's incredible. It sounds like pulmonary rehabilitation is a really holistic approach to managing COPD.
It is. It's not just about the physical benefits. The education and support components are just as important.
What kind of things are covered in the education part?
It might include learning about COPD, how to use your medications effectively, breathing techniques, energy conservation strategies, and how to avoid triggers that can worsen your symptoms.
It seems like knowledge really is power when it comes to managing COPD.
Absolutely. Understanding your condition and how to manage it can make a world of difference.
Now, the Goldie guidelines also mention oxygen therapy as a treatment option. When is that typically recommended?
Oxygen therapy is typically recommended for people with severe COPD who have low blood oxygen levels.
So they're literally getting supplemental oxygen to help them breathe better.
Exactly. It's delivered through a mask or nasal cannula and can be used at home or on the go, depending on the individual's needs.
It seems like there's a whole arsenal of treatments available, from medications to pulmonary rehabilitation to oxygen therapy.
Yeah.
It's amazing how far we've come in terms of managing COPD.
It is. There's still no cure, But with the right management, people with COPD can live long and fulfilling lives.
And that's what it's all about, isn't it? Finding ways to breathe easier and live your best life despite the challenges of COPD.
Okay, so we've covered the treatment options in detail, but there's one more thing I want to touch on before we wrap up. Preventing those dreaded exacerbations.
Yes, preventing exacerbations is a key part of effective COPD management. The GOLD guidelines highlight a number of strategies for preventing exacerbations. But if you had to pick the single most important piece of advice, what would it be?
Without a doubt, the most important thing you can do to prevent exacerbations is to avoid triggers.
Triggers being anything that irritates your airways and makes your COPD symptoms worse.
Exactly. And the number one trigger for most people with COPD is smoking.
So quitting smoking is absolutely essential if you want to manage your COPD effectively and prevent those flare-ups.
Absolutely. I can't emphasize that enough. Even if you've been smoking for years, quitting can still make a huge difference in your lung health and overall well-being.
I know it's easier said than done, but there are resources available to help people quit, right?
Absolutely. There are medications that can help reduce cravings and manage withdrawal symptoms. There are support groups and counseling programs. Talk to your doctor about what might work for you.
And even if you don't smoke yourself, it's important to avoid secondhand smoke, right?
Definitely. Secondhand smoke is just as harmful as smoking yourself, especially if you have COPD.
Okay, so quitting smoking or avoiding it altogether is top priority. What are some other common triggers that people with COPD should be aware of?
Well, air pollution is a big one. If you live in an area with poor air quality, try to limit your time outdoors, especially on days when pollution levels are high.
So checking the air quality index before you head out might be a good idea.
Exactly. And if you do need to be outside when the air is bad, consider wearing a mask.
Makes sense. Are there any indoor triggers people should be mindful of?
Absolutely. Dust mites, pet dander, mold, and even strong fumes from cleaning products or perfumes can irritate the airways and trigger exacerbations.
So it's about being aware of your environment, both indoors and outdoors, and taking steps to minimize exposure to those irritants.
Precisely. Now, aside from avoiding triggers, there are other important things you can do to prevent exacerbations.
Like what?
Well, staying up to date on your vaccinations is crucial. The flu shot is especially important for people with COPD, as the flu can trigger serious exacerbations.
And I imagine the COVID-19 vaccine is important as well, given how dangerous respiratory infections can be for people with COPD.
Absolutely. Protecting yourself from those viruses is paramount.
Okay, vaccinations are on the list. Anything else?
Well, taking good care of your overall health is essential. Eating a healthy diet, getting regular exercise, and managing stress can all help strengthen your immune system and reduce your risk of getting sick.
So it's a holistic approach, really. It's not just about managing your COPD in isolation. It's about taking care of your whole body and mind.
Exactly. And that includes getting enough sleep. When you're sleep deprived, your immune system weakens, making you more susceptible to infections.
So prioritizing those Z's is important. Avoiding triggers, vaccinations, good overall health, and plenty of sleep. Are there any other preventative measures people with COPD should consider?
One more important thing is to recognize the early warning signs of an exacerbation.
We talked about those earlier, but can you remind us what those signs might be?
Sure, it can vary from person to person, but pay attention to things like increased coughing, a change in the color or thickness of your mucus, increased shortness of breath, wheezing, and feeling more fatigue than usual.
So it's about tuning into your body and noticing any subtle changes that might signal an exacerbation is brewing.
Exactly. Early intervention is key. If you notice those early warning signs, contact your doctor right away.
This all makes a lot of sense. It seems like preventing exacerbations is really about being proactive and taking control of your health.
It is. It's about understanding your triggers, protecting yourself from infections, maintaining a healthy lifestyle, and being vigilant about any changes in your symptoms.
Okay, we've covered a ton of ground here, from treatment options to preventative strategies. It's a lot to digest, but hopefully it's empowering to know that there are so many things you can do to manage COPD effectively and live a fulfilling life.
Absolutely. Knowledge is power. And the more you understand about your condition, the better equipped you'll be to navigate the challenges and make informed decisions about your health.
So are you ready to explore some of those challenges and delve into the future of COPD management?
Let's do it. I'm eager to shed light on some of the complexities and emerging trends in this field.
Then join us for the final part of our deep dive into the GOLD guidelines, where we'll tackle some of the tougher questions and look ahead to what the future holds for COPD care. We've explored the ins and outs of COPD, from diagnosis and treatment to those all-important preventative strategies. But you've also flagged some articles about the challenges and the future of COPD care. So let's wrap up by getting into some of those deeper complexities.
Yeah, it's important to acknowledge those complexities because COPD is a multifaceted disease, and it affects everyone differently.
Right. It's not just a matter of looking at someone's FEV1 score and saying, okay, you're at this stage of COPD, this is the treatment.
Exactly. Two people with the same Gold-Digger grade can have completely different experiences. One person might be relatively symptom-free and able to maintain like a normal level of activity, while another person might experience, significant breathlessness and limitations in their daily life.
So it's really about understanding the individual and how COPD is impacting their life, not just focusing on those lung function numbers.
Absolutely. The Goldie guidelines emphasize that personalized treatment tailored to the individual's needs and goals is essential for achieving the best possible outcomes.
Now, what with the articles you sent in highlighted the fact that COPD is often diagnosed late, sometimes not until it's quite advanced. Why do you think that is?
Well, there are a few reasons for that. For one, early symptoms of COPD, like a persistent cough or mild shortness of breath, can be easily dismissed as just part of getting older or being out of shape.
So people might not recognize those early signs as something serious enough to warrant medical attention?
Exactly. And then there's the stigma associated with smoking. Many people feel ashamed or embarrassed about their smoking history, so they might downplay their symptoms or avoid seeking medical care.
That makes sense. It seems like raising awareness about the early signs of COPD and encouraging people to seek medical advice, regardless of their smoking history, is crucial.
I completely agree. Early diagnosis is key for effective management. The earlier you start treatment, the better your chances of slowing down the progression of the disease and preserving lung function.
Another article you flagged talked about the challenges of adherence to treatment. Can you elaborate on that a bit?
Sure. Adherence to treatment means following your doctor's recommendations consistently, taking your medications as prescribed, and sticking to your treatment plan.
And that can be difficult for people with COPD, especially when treatment often involves taking multiple medications every day, potentially for the rest of your life.
Absolutely. It can feel overwhelming trying to manage those medications. Remembering to take them on time, dealing with potential side effects, and fitting it all into your daily routine.
So what can be done to help people with COPD stick to their treatment plans and improve adherence?
Well, communication is key. It's important to have open and honest conversations with your doctor about any challenges you're facing. If you're struggling to remember to take your medications, for example, they might suggest a pill organizer or a medication reminder app.
So it's about finding solutions that work for you and your lifestyle.
Exactly. And sometimes it might be a matter of adjusting the treatment plan itself. If you're experiencing side effects from a particular medication, for example, your doctor might be able to switch you to a different medication or adjust the dosage.
It's about working collaboratively with your healthcare team to find the best possible approach for you.
I couldn't agree more. And beyond those practical strategies, it's also important to address the emotional and psychological aspects of living with a chronic illness like COPD.
Yeah, you're right. It's not just about the physical symptoms. It's about the impact on your mental and emotional well-being.
Exactly. Living with COPD can be stressful and challenging, and those feelings are valid. Talking to a therapist or joining a support group can be incredibly helpful in coping with those challenges.
So it's about finding support and connecting with others who understand what you're going through.
Exactly. And as much as we've focused on the challenges, I think it's important to end on a hopeful note. There's a lot of exciting research happening in the field of COPD, and the future looks promising.
That's great to hear. What are some of the most promising developments you've seen?
One area of focus is on developing new medications that are more effective, longer lasting, and have fewer side effects.
So constantly refining the medications available to better manage symptoms and improve quality of life.
Exactly. There's also research into new inhaler devices that are easier to use and deliver medication more efficiently.
Yeah, that would be a game changer for many people with COPD who struggle with those inhalers.
I think so too. And there's growing interest in personalized medicine, using genetic testing to identify individuals who might respond better to certain medications.
So tailoring treatment even further based on a person's unique genetic makeup.
Precisely. And beyond medication development, there are advances in technology, like telehealth and remote monitoring, that are making it easier for people to access care and stay connected with their healthcare providers.
It sounds like the future of COPD care is all about individualized treatment, innovative technologies, and empowering people to take control of their health.
I think that's a great way to sum it up. And ultimately, that's what the Goldie Guidelines are all about. They're a roadmap for providing the best possible care for people with COPD, based on the latest scientific evidence and a deep understanding of the complexities of this disease.
Okay, we've covered a lot of ground in this deep dive. We've learned about the causes, symptoms, diagnosis, and treatment of COPD. We've explored the importance of personalized care, preventing exacerbations, and the role of lifestyle factors. We've even delved into some of the challenges and emerging trends in COPD management.
It's been a thorough exploration, and I hope it's equipped you with the knowledge and insights you need to navigate your own journey with the COPD.
Exactly. Remember, COPD is manageable. With the right treatment, support, and self-care strategies, you can live a full and active life. Don't be afraid to ask questions, advocate for your health, and stay informed about the latest developments.
And above all, remember that you're not alone. There are resources available both online and in your community to support you on your COPD journey.
Thank you for joining us on this deep dive into the GOLD guidelines for COPD. We hope you found this information helpful and empowering.
Until next time, keep learning, keep breathing, and keep living your best life.